Welcome. MNsure is excited to talk about our open enrollment for the next plan year, 2026. We're here today with MNsure CEO Libby, Caulum, Navigator Jonathan Marchand, and our Senior Director of Partner Relations, Christina Wessel, and we'll be able to answer questions at the end. So please hold your questions to the end. Reminder to keep your mics muted until called on. You can use the chat feature or raise your hand at the end for questions. And I will start by handing it off to our MNsure CEO, Libby Caulum.
Thank you, Erica. Good morning. I'm Libby Caulum, CEO of MNsure, Minnesota's official health insurance marketplace. Each year, MNsure helps thousands of Minnesotans apply and enroll in coverage. Most find coverage during our open enrollment period, which started on Saturday. I'm here today to talk about the Minnesotans we serve, what's on their minds right now, including the uncertainty that's coming out of Washington, and how MNsure can help. I'm also going to walk through our plan shopping tool with you so you can get a clear sense of what consumers experience when they shop for coverage through MNsure.org. MNsure is here to help thousands of Minnesotans who don't have access to affordable insurance through their jobs. Most Minnesotans today get health insurance through their jobs, but lots of individuals and families simply don't have access to employer-sponsored coverage. This includes farmers, small business owners, entrepreneurs, gig freelance workers, and contract workers, people with multiple part-time jobs, and early retirees who aren't eligible for Medicare yet. These folks don't have a human resources department to turn to for help, but they all deserve access to quality, comprehensive coverage and support when choosing a plan. Health insurance is getting a lot of attention lately, as you know, and we know Minnesotans have lots of questions about their health coverage, access, and the costs. So far, the federal government has failed to extend some savings that are currently scheduled to expire at the end of 2025. These are known as the enhanced premium tax credits, and they've made health insurance more affordable for nearly 90,000 of our enrollees in recent years. Minnesotans are facing rising healthcare costs, and their current plan may cost more next year. They may also be getting online ads or phone calls from scammers trying to sell them a junk plan. They're wondering how they can get quality coverage that meets their needs and their budget situation. Thankfully, Minnesota has MNsure, our official health insurance marketplace. MNsure offers quick cost estimates, free application and enrollment help from local trusted experts, lots of good plan choices. There are about 260 medical and dental plans for 2026. All Minnesotans have choices from at least 2 insurance companies, and most have choices from 3 or more insurance companies. We have coverage you can trust. We partner with reputable, licensed insurance companies. All health plans are guaranteed to cover the important healthcare services that people need, like doctor's visits, prescription costs, prescription drugs, and emergency care. And plans sold elsewhere may not offer those same benefits and consumer protections. Finally, access to federal financial help through tax credits is only available through MNsure. As I mentioned earlier, we're still waiting to see if Congress will extend the enhanced premium tax credits. But today, I want to emphasize, even if some federal savings end, many Minnesotans will still qualify for substantial savings next year. On average, eligible households will save $600 per month in 2026. That's over $7,000 annually. Minnesotans can check for savings by using our online shop and compare tool. This is a fast and convenient way for consumers to understand their coverage options and see what financial help they may qualify for before they even fill out an application. I'm going to demonstrate with a quick example to highlight just how straightforward it can be. So let's take a 30-year-old in Austin, Minnesota, who needs health insurance for next year. His income varies, but he expects to make about $39,000 next year. He'll put in where he lives. He's included his Austin area zip code here in Mower County, who is in his household, his annual income of $39,000. And with just these 3 pieces of information, he gets an immediate estimate of the financial help that he could get through MNsure. So this next slide shows the results. He's likely eligible for tax credits that will lower his healthcare costs. The estimate says he could receive $314 per month in tax credits to reduce his monthly premium. From here, he has 2 options. He can answer some optional additional questions about his healthcare needs that could help him focus his plan shopping, or he can jump straight into viewing plans. On the next slide, we see a snapshot of the first few health plans that are available in his area. With his savings estimate in hand, he'll see the monthly cost for each plan after those tax credits. He can view options from multiple companies side by side, check to see if his doctor is in the plan's network, and compare costs. On the left-hand side, you can see some of the options consumers can use to help them narrow their choices and find the best fit. For example, he can sort by monthly price or yearly deductible. He can apply the HSA eligible filter to find plans that work with a health savings account. And this is similar to an online shopping experience, like where you're, searching for a pair of jeans or a sweatshirt, and you sort from by price from low to high. After using the Shop and Compare tool, consumers may be ready to choose a plan. Since we're in open enrollment right now, they can apply and finish their enrollment all in one sitting, or they can take advantage of free application and enrollment help from a trusted expert. I want to talk a little bit about our deadlines. So open enrollment runs from November 1st through January 15th, 2026. But there's an important early deadline that comes up fast. December 15th is the deadline to enroll in a full year of coverage that starts on January 1st. If you miss the December deadline, your coverage will start February 1st instead. So as we kick off our open enrollment period, I want to take a moment to acknowledge the great success Minnesota has had in recent years. Thanks to smart policy choices and the tenacious efforts of our navigators, brokers, and health systems, providers, and many community organizations, our state has been able to reduce our uninsured rate to a record low of under 4%. That means more of our neighbors, coworkers, and friends have the security of health insurance, and they can access the care and medications they need to be healthy. We want to keep that momentum going and keep Minnesota covered. The best way to put it in practice is simple. Make a plan to enroll. Check your current plan. Does that plan still meet your needs? You can schedule a free appointment for help. And you can mark your calendar and set reminders to make sure you get it done by those important deadlines. And we're asking Minnesotans to check in with their community too. Waiting at the school bus stop with your neighbors, getting your hair cut, buying a cup of coffee, doing your holiday shopping. These are all opportunities to ask and make sure your family, friends, and neighbors are covered for next year. So next, I'd like to turn it over to Jonathan. He's from Community Services. He's our Community Services Manager at the United Community Action Partnership.
Hi, thanks, Libby. My name is Jonathan Marchand. I am a Community Services Manager at United Community Action Partnership, also a MNsure navigator, and have been a certified navigator since MNsure rolled out back in 2014. We have helped a considerable number of people over those years to apply for and enroll in affordable health insurance available through the MNsure exchange. Our agency is a community action agency, meaning that our focus populations tend to be more low-income folks, and rural. We cover 9 counties in our agency, from McLeod County through Meeker, Candy, Ojai, Renville, Redwood, all the way down to Jackson. And we are also part of a consortium grant with some other community action agencies, and we end up serving about 30 counties in rural Minnesota. Now, having kind of a focus on low-income families does not mean that that is all that we can see. We have the MNsure badge on our door. That means we are here to help consumers enroll in health insurance. So we can really take all comers that just have any questions and are looking to enroll in affordable coverage. Our navigators are trained and certified through MNsure to screen for folks, to ask them the questions they need to know up front. What is our household income we're looking for? How many people do we have in the household? Do we have access to employer-sponsored coverage? And just to really help drill down the basic eligibility that folks have to enroll in MNsure. From there, we can help them to create their account, to make an application through their account, and then enroll in coverage at the back end of that process. We are able to look at the plans that are available on the marketplace and really kind of help consumers drill down to see, kind of compare one plan to another and see what plans are going to help them the best. We do not offer advice to consumers as far as what plans to select, but we can really kind of look at all of those plans and help them to make their best educated decision. We also engage in a lot of community outreach in the areas that we work in to raise folks' awareness of those dates of open enrollment, of the fact that free assistance is available to them, that they're not alone in this process, and that our navigators are there to help with every step, either up to, during, and even after the application and enrollment process. We also have assistance available in multiple languages directly from navigators who speak, who are fluent in many, bilingually fluent in speaking Somali and speaking Spanish, Korean, just a number of different same language services for folks that really need that assistance. And our outreach, we really, since we're in a rural area, we try to hit all the corners that we can get into. And that means going out and doing community canvassing, going out and tabling at places like our colleges, community colleges and universities. We do a lot of speaking at public events. We do a lot of literature distributions at different sites like our Head Start sites and different like food and food shelves and pantries. Just really everywhere that we can catch people, we want to make them aware that assistance is available to them to enroll and or apply and enroll in health insurance coverage.
Thank you, Jonathan. And we'll pass to Christina Wessel.
Thank you, Libby. Good morning, everyone. My name is Christina Wessel, and I'm the Senior Director of Partner Relations at MNsure. In my role, I have the privilege of working with Minnesota's community-based partners like Jonathan. But this morning, I also want to highlight another important resource available to help Minnesotans. Many people are already familiar with the idea of working with a broker, for example, for their car or home insurance, but there are also brokers to help you with picking out the right health insurance plan for your situation. MNsure partners with more than 1,300 brokers around the state who are licensed and certified to help Minnesotans with enrolling in coverage. There is a lot of value in working with a broker. They are familiar with the plans available through MNsure, so they can help you understand important elements of your decision, like looking at copays, networks, and prescription drug coverage, and advise you on what plan may be best for you. They can also look at health insurance as part of your larger financial picture, so deciding whether a bronze, silver, or gold level plan, or even an HSA eligible plan is right for you. And a broker can help you throughout the year if you have questions about your coverage or if you need help resolving issues with the insurance company. Like with other types of insurance, working with a broker to pick your health insurance is almost always free. If they do have any fees, which is pretty rare, they are required to let you know upfront. And with more than 1,000 brokers available to help, you can find someone that is a good fit for you, whether you want to meet in person or if you prefer a virtual appointment. But we know this will be a very busy year. And we are hearing from our broker partners that appointments are filling up really fast. So we encourage people to go to MNsure.org and go to Find Free Help to look for a broker using the Assister directory. And it is really important to find a broker through our Assister directory. You want to make sure you are working with a broker who is certified through MNsure so that they can help you access any financial help like tax credits that you may be eligible for.